Hello everyone, I'm Dr. Al and today we're going to talk about plab 2. I've been getting a lot of questions about the stations when you have to explain test results for a patient, or it's a follow-up station or stuff like this. You have to keep in mind that in the exam, this station could be results for anything. It could be CT, it could be chest x-ray, it could be blood results, it could be literally everything. Today, for the sake of this video, I'm going to talk about when you have to deliver test results as in blood results for the patient. And for that, we all know the most common disease of all time is iron deficiency anemia. So for the sake of the video, let's pretend that today we're going to talk about a patient who presented with iron deficiency anemia and we have to deliver the blood result, okay? You know the station's history, the history structure as I have mentioned in my previous videos. Do we have to go through them one by one? Most likely yes, but it is going to be a little bit different. So in the first part, history of chief complaint, here you want to ask about why did the patient have these blood results in the first place? I know that the station says follow-up, but you have to remember you might not be the doctor who ordered these investigations and the doctor who saw the patient last time. You might be an FY2, you might be a junior, the tests were ordered from a senior. You might be locuming, for example. Just think about it like this. If the station does not say you know the patient, don't assume that you do. You go in, you introduce yourself, you start with the chief complaint. The chief complaint here is why have you done these investigations in the first place? We want to ask a little bit of questions here. Here, why you have done these investigations is not really important. I'll tell you why. Because you have the diagnosis. So the patient has done these investigations, hypothetically speaking, for tiredness. We know the reason behind tiredness is iron deficiency anemia. So a simple question like why have you done it would be enough. You don't have to ask a million questions about the chief complaint. You can just simply go straight to P2. P2, as I mentioned in my previous video, history of chief complaint. Have you ever had this tiredness before? Have you ever had this vomiting before? Have you ever had this chest pain before? Here as well is not very important. Why? Because we have the diagnosis. We want to go to the second part of P2, which is other past medical history. Hypothetically, if the patient has iron deficiency anemia, we want to search for things that might cause iron deficiency anemia, whether it was malabsorption. For example, if you ask a 16-year-old patient and they simply straight away said, oh, I have celiac disease, are you going to investigate more and more and more? No, if the patient has already a diagnosis of celiac disease, you don't have to send for endoscopy, for example. Moving on. So you've asked about past medical history. Now you need to ask about other things, like past surgical history. Has the patient had any surgeries that might cause iron deficiency anemia? That's important. Medication. Are you taking any medication that might be the reason? Let me give you a hypothetical situation. Let's say your patient is a sportsman, like an athlete, who had an injury in the shoulder. And right now is using ibuprofen or diclofenac with no stomach protection. That would be a red flag. That's something you have to investigate. You might send for OGD. Do you see how you have to think about it? Carrying on with the lifestyle. Very important to ask about diet, smoking. Smoking is a risk factor for cancer. Cancer could be a reason for iron deficiency anemia. And moving on with the same structure of history that I've mentioned in my previous video. Note something is that we are looking for two things. We're looking for reasons to blame for the iron deficiency anemia, and we're looking for complication that would indicate acute interfere or acute referral, urgent referral. Once you finish your history, and you have to be quick, and here you don't have to dive into the specific details of the chief complaint. You're looking for complications. After you finish all of that, after you finish the history, you can simply ask about complication of iron deficiency anemia. For example, complication of all anemia are the same: palpitation, chest pain, dizziness, the big ones. You're not going to go and tell them, oh, do you feel tired? Do you feel sleepy? That's not something that would indicate an acute referral. Do you know what I mean? After that, you want to start ahead with the management. In the management, as I said, 5 points. First one, seniors. Do we need seniors? I don't think we need. Am I right, guys? Okay. Second one, investigations. Do we need more investigation at the moment? Think about it like this. It depends on the patient. Hypothetically, 60-year-old patient with iron deficiency anemia. Does the patient need investigations? Of course. Any 60-year-old with an iron deficiency anemia, we're going to refer for investigations because risk factors for cancer. The patient mentioned like this, the one I said, one on ibuprofen with iron deficiency anemia. We are going to send for investigation. So you have to think about it like that. After that, symptomatic treatment. Do we have any symptoms we need to treat? No. Okay, other than the symptomatic, do we have any advice we can give? Of course, we can give advice about red meat, dark green. All of these, we can also give the patient a piece of advice, which is cut down on tea, drink a lot of vitamin C, because vitamin C helps absorb iron. Tea tends to decrease iron absorption. After that, finally, is the main point, which is how do we the real treatment for the patient. Start on a tablet, take one tablet, for example, and basically that's it. Don't forget to safety net the patient. That's something we automatically do, and you should be in the clear zone. Okay, guys? If you want to know about other test investigation, feel free to jump into the comment and I will discuss them with you, whether it was chest x-ray, CT scan, anything you want.